polio. Poliomyelitis, also known as polio or infantile paralysis, is a highly contagious and infectious disease caused by a virus that attacks the nervous system. Children younger than 5 years old are more likely to contract the virus than any other group. In about 0.5% of cases there is muscle weakness resulting in an inability to move, paralysis, and in severe cases, can be life-threatening. This can occur over a few hours to a few days. The weakness most often involves the legs but may less commonly involve the muscles of the head, neck and diaphragm. Types of polio. There are 3 types of polio. 1. Abortive polio. About 4 to 8% of people who are infected suffered from mild illness polio known as abortive poliomyelitis. This type of polio doesn't cause paralysis, only fever, sore throat, mild headache, nausea and vomiting, and either constipation or diarrhea, which usually improve within about 3 days. 2. Non-paralytic polio typically produce the same disease symptoms of abortive polio, with additional neurological symptoms, such as sensitivity to light and neck stiffness. 3. Paralytic polio. Less than 1% of those infected develop this severe form of the disease. In cases of paralytic polio, the virus spreads from the intestine to the brain and spinal cord, causing damage to the nerves that control muscle movement, so loss of superficial reflexes and muscle pain or spasm occurs. Paralytic polio leads to paralysis in the spinal cord. Spinal polio. Brain stem bulbar polio or both bulbospinal polio. Causes of polio. Polio is caused by infection with a member of the genus enterovirus known as poliovirus PV, a highly contagious virus. This group of RNA viruses colonize the gastrointestinal tract, specifically the oropharynx and the intestine. It is spread by contact with infected feces, swallowing contaminated food or water, or by direct contact with an infected person. Objects like toys that have come near infected feces can also transmit the virus. Sometimes it can't transmit through a sneeze or a cough, as the virus lives in the throat and intestines. This is less common. Pregnant women, people with weakened immune systems, such as those who are HIV positive, and young children are the most susceptible to the polio virus. If you have not been vaccinated, you can increase your risk of contracting polio when you travel to an area that has had a recent polio outbreak. Take care of or live with someone infected with polio. Handle a laboratory specimen of the virus. Have your tonsils removed. Symptoms of polio. Symptoms of non-paralytic polio can last from 1 to 10 days, can be flu-like including fever, sore throat, headache, vomiting, fatigue, meningitis. Initial symptoms of paralytic polio are similar to non-paralytic polio, but after a week, more severe symptoms appear. These symptoms include loss of reflexes, severe spasms and muscle pain, loose and floppy limbs, sometimes on just one side of the body, sudden paralysis, temporary or permanent deformed limbs, especially the hips, ankles, and feet. Diagnosis of polio. Doctors diagnose polio by looking at your symptoms. A physical examination is done to look for impaired reflexes, back and neck stiffness, or difficulty lifting your head while lying flat. Labs will also test the sample of your throat, stool, or cerebrospinal fluid for the polio virus. Antibodies to poliovirus are generally detected in the blood of infected patients early in the course of infection. Analysis of the patient's cerebrospinal fluid (CSF), which is collected by a lumbar puncture, reveals an increased number of white blood cells and a mildly elevated protein level. Prevention of polio. Polio can be prevented by vaccination against the virus that causes the disease. Two types of vaccine are available worldwide. The inactivated poliomyelitis vaccine (IPV), which is given by injection, and the oral poliomyelitis vaccine (OPV), which is taken by mouth. Treatment of polio. There is no cure for polio, but there are some common treatments that can help treat some of the effects of the disease. Bed rest painkillers, antispasmodic drugs to relax muscles, antibiotics for urinary tract infections, portable ventilators to help with breathing, physical therapy or corrective braces to help with walking, heating pads or massage to ease muscle aches and spasms, physical therapy exercise to help improve mobility in the affected muscles, physical therapy to address breathing and pulmonary problems. Sometimes surgery and physiotherapy can help correct limb deformities. In advanced cases of leg weakness, you may need a wheelchair or other mobility device. If you liked the video, please subscribe, like, comment and share.